It's a great pleasure to be here this morning for the launch of Adding It Up. We meet at a very important moment on the eve of a year when the global community is going to rewrite the future of human development. One of the important lessons of the Millennium Development Goals is that women are the face of poverty, and investing in women and health is crucial to advancing the wealth and the well-being of our societies. What is the evidence? What are the costs of investing in sexual reproductive health? What are the benefits and what are the priorities?
So now I'm going to turn to the key findings of the report. That first, there has been substantial progress in the past decade in meeting women's sexual and reproductive health care needs, so we have made progress. But secondly, despite that progress, large gaps still remain, especially among the poorest women and in the poorest countries. And thirdly, that there are enormous benefits that would result from investing in meeting these needs. For each dollar spent on contraceptive care, we will save about $1.47, $1.50 on maternal and newborn care. And we're talking about a very narrow set of services up to the age of 6 weeks of the newborn. 225 million women who have an unmet need for contraception, modern methods. If their needs were met, that would prevent 52 million unintended pregnancies, and that would be a 70% reduction from what it is now, which is 74 million. There would be 21 million fewer unplanned births, 24 million fewer abortions, of which 15 million would have been unsafe, 600,000 fewer stillbirths, and 6 million fewer miscarriages. If the existing needs for contraception and maternal and newborn care were met, the number of women dying from maternal causes would drop from 290,000 to 96,000 each year. That's a very large reduction, about 2/3. And what would it cost to provide all of these services? Contraceptive care, maternal and newborn services, the services that the HIV pregnant women need, as well as treatment for STIs for all women in the developing world. And we estimated that would cost just over $39 billion each year. I know the figure sounds very large. What we make the point is that when you convert that large $39 billion figure into what it would be per woman of reproductive age, it's $25 per woman, which it's also $7 per person in the developing world. Remember too that current services, this is the total cost, so current services that are occurring, already about half of this amount is being covered by governments, families themselves, some contributions from donor agencies. So the amount that we need to meet is about half of this. That's a very modest increase for a huge benefit. We would say it's a best buy.
When I look at Adding It Up, and indeed at all of Guttmacher's reports, fact sheets, and other materials, I always think of that wonderful line that statistics are human beings with the tears wiped off. Being able to decide on the number and spacing of their children, having a healthy pregnancy and childbirth are a basic human right and are fundamental requirements for enabling women to achieve their full potential. I want to highlight another key element of the story that Adding It Up tells, the need to focus on women and families who are most disadvantaged because of poverty, ethnicity, age, or rural residence. As the report makes clear, there are shockingly huge disparities in the use of services between poor and wealthy countries and between poor and wealthy women within countries. Adding It Up shows us why we must act. It tells us how much we need to invest, and it demonstrates what will happen when we do. We must see the tears and understand the statistics in order to meet the very real needs of women, their families, and their communities throughout the developing world.
I'm passionate about this because this is something I've lived for more than 40 years of my life. I'm actually struck that all we're looking for is $39 billion. I was listening to the news the other day, and the amount that the United States will spend over Christmas on chocolate is $61 billion. So really, what we're looking for is not totally out of sight. So we've had all the benefits of these investments. We've done the maths, and you know, when I think about it, all we're asking for investment of $25 per year per woman. I mean, that's really, and in the report it actually says so, that's how much we spend to watch a movie and popcorn, you know. And I think that we can do that. The world should be able to do that to ensure protection of health, not only for the woman, but for the child. Let us persuade governments to invest more in their people.
To me, I see the provision of sexual and reproductive health as a very good development argument, because we'll have fewer unplanned pregnancies. That means healthier mothers. That also means healthier babies, healthier children, children able to go to school, then more importantly, more economic productivity. And I think in the long run, this will lead to less dependency on aid.